Poem syndrome is a paraneoplastic process characterized by the underlying presence of a monoclonal plasma cell disorder, peripheral neuropathy, and other features. The cause of Poem syndrome is unknown, although chronic overproduction of pro-inflammatory and other cytokines, such as vascular endothelial growth factor, seems to be a main feature of this disorder, accounting for its symptoms such as increased permeability, vascularity, among others. Poem syndrome is a rare disorder. The exact incidence is unknown, although a national survey conducted in Japan, where the disease has been widely studied in 2003, showed a prevalence of approximately 0.3 cases per 100,000 persons. Diagnosis is made when two of the strict major mandatory criteria are met: polyneuropathy and monoclonal plasma cell disorder, at least one of the other major criteria, either Castleman disease, sclerotic bone lesions and imaging, or VEGF elevation, and at least one of the minor criteria are met, including effusions, endocrinopathy, organomegaly, thrombocytosis, polycythemia, among others. Pathology usually reveals plasma cell hyperplasia, usually monoclonal with lambda chain restriction. Only one-third of the patients can have polyclonality in the bone marrow, with lymphoid aggregates and plasma cell rimming around them, such as we see in Figure 1. There are usually no chromosomal abnormalities, but somatic mutations of several genes by exon sequencing have been linked to the disorder. Treatment of Poem's disorder depends on risk stratification. Patients with a clinical phenotype presenting a solitary plasmacytoma on the spine, deemed a lower risk, undergo radiation as first-line treatment. Patients with systemic disease have chemotherapy, mainly alkylators, as mainstay treatment. Steroids can be a temporizing solution and are sometimes added to chemotherapy regimens. And for those with suboptimal improvement after this, autologous stem cell transplant shows 100% improvement of symptoms for patients who survive it. Our case is about a 50-year-old male with no relevant medical history who presented with 2 months of progressive bilateral lower extremity weakness, diminished sensation with tingling and numbness, and absent deep tendon reflexes. His exam was also pertinent for skin hemangiomas, such as seen in Figure 2. His labs were pertinent for polycythemia, thrombocytosis, and leukocytosis, as well as elevated globulins and an SPEP that showed a monoclonal spike with lambda chain restriction by immunofixation. MRI of thoracic and lumbar spine was done that revealed heterogeneous sclerotic lesions that vividly enhanced after contrast, such as the one we're seeing in S1 in Figure 3. That's an MRI spine with and without IV contrast, found to be aggressive hemangiomas later on by biopsy. LP revealed albuminocytological dissociation, and he was started on a trial of IVIG per neurology for suspicion of AIDP versus CIDP with minimal relief after 5 cycles. Bone marrow biopsy was then done and revealed an increased number of plasma cells, over 10%, as well as lymphoid aggregates, and further workup revealed elevated VEGF levels as well as low testosterone. He was then diagnosed meeting criteria for Poems and was started on chemotherapy regimen for 4 months with suboptimal improvement, and later on received autologous stem cell transplant given he was deemed a good candidate based on his overall health and age. He had some complications but is now recovering and improving in terms of his symptoms. This case represents a rarity within Poem's diagnosis itself, which is already rare, given the polyclonality found in the bone marrow in the setting of systemic disease, which is very uncommon. Diagnosis of Poem syndrome is extremely challenging, given multi-organ and multi-system involvement, with systems and symptoms that do not seem apparently related to each other, which accounts or demands for the need of a high degree of clinical suspicion when appropriate, meaning in the setting of neuropathy of unknown cause, refractory effusions or edema, or others, and it requires a true transdisciplinary approach, with radiology and pathology services playing a central role, as they did in this case. High degree of variation in clinical, laboratory, and pathology findings also account for difficulties in diagnosis, which usually results in late diagnosis and therefore marked neurological involvement. This case aims at educating the medical community about this rare disease, given its good prognosis with current treatment, and hopes for more upcoming knowledge, especially in the genetic field, about this disease, which seems very promising, which hopefully will influence future detection and management of Poems. Thank you.